Good afternoon, student. Today's topic of discussion is the ciliary ganglia. Come to the introduction slide. The ciliary ganglion is one of the four parasympathetic ganglia of the head and neck. The other three parasympathetic ganglia are the otic ganglion, the sphenoidopalatal ganglion, and the submandibular ganglion. And the ciliary ganglion, it is smallest among these, and the diameter of this ganglion is 1 to 2 millimeter. It is irregular in shape and it looks like a pinhead. It mainly receives the parasympathetic supply from the oculomotor nerve, and the ciliary ganglion is concerned with the innervation of the intraocular muscle. You all know the intraocular muscle. These are the ciliary muscle and this sphincter pupillae. Then come to the location of this ganglia. The ciliary ganglion is located near the apex of the orbit between the optic nerve and the lateral rectus. So these are the orbit and this part is the apex. So it is situated near the apex of the orbit and it lies lateral to the optic nerve. This thicker one is the optic nerve. It lies lateral to the optic nerve and it lies medial to the lateral rectus, in between this optic nerve and this lateral rectus, and it hangs from the nasociliary nerve, but it belongs to the oculomotor nerve. Okay, not only that, it is situated lateral to the ophthalmic artery, approximately 1 cm anterior to the annulus of gene and 1.5 to 2 cm posterior to the globe. So it lies 1.5 to 2 cm posterior to the globe, and in this region there is annulus of gene. It lies around 1 cm anterior to this annulus of gene. You all know this annulus of gene. The annulus of gene, it is a tendinous origin part from which the extraocular muscle takes origin, and the optic nerve enters the orbit through this region. To go to the next slide. This is the ciliary ganglion, and the ciliary ganglion, it suspends from this nasociliary nerve. This one is the nasociliary nerve, this one, and from this nasociliary nerve, this part is the branches. It is the long ciliary nerve, and from the nasociliary nerve the ciliary ganglion hangs, but functionally it is related to this oculomotor nerve, and the nasociliary nerve, it is a branch of the ophthalmic division of this trigeminal nerve. Okay, and this small branches which comes out from the ciliary ganglion, these are the short ciliary nerve, short ciliary, and these are the which comes from this nasociliary nerve, these are the long ciliary nerve. Okay, come to the next slide. The roots. You all know this parasympathetic ganglia, all the time it has three types of actions or three types of nerve. The three types of action enters the ciliary ganglion, but only one type of actions synapse there, the preganglionic parasympathetic action. So the parasympathetic roots, the parasympathetic nerve, it only synapse inside this ciliary ganglion, but the other two types of root, it enters the ganglion and do not synapse in this region, it only pass through the ganglion. So come to the first root, the sensory root. The sensory root come from the nasociliary nerve. The sensory action supply the cornea, ciliary body and iris. So the general sensation from this cornea, ciliary body and iris, it passes to the nasociliary nerve through this nerve, long ciliary nerve. From this long ciliary nerve, the general sensation come to the nasociliary nerve, and from this nasociliary nerve it goes to the ophthalmic division, then to the trigeminal ganglia, and from this trigeminal ganglia to the trigeminal nucleus. Okay, then come to the sympathetic root. The sympathetic root, it originates from the internal carotid plexus with cell body in the superior cervical ganglion. So from the superior cervical ganglion, some sympathetic nerve root, it goes to the carotid plexus, and from the carotid plexus, some of the sympathetic root, it enters into this ciliary ganglion. The sympathetic root contains the postganglionic sympathetic action which supply the blood vessel of the eye. It only supplies the blood vessel of the eye, the sympathetic root. Then come to the parasympathetic root, and this is the most important part of this ciliary ganglion. The parasympathetic root branches from the inferior division of the oculomotor nerve. You all know this oculomotor nerve, it has two divisions, the superior division and the inferior division. From this inferior division, the parasympathetic root branches from this inferior division of the oculomotor nerve, and that it enters into the ciliary ganglion. The preganglionic parasympathetic action come from the Edinger-Westphal nucleus. So the preganglionic parasympathetic action come from the Edinger-Westphal nucleus, and postganglionic parasympathetic neuron project through the short ciliary nerve to innervate the ciliary muscle and the pupillary sphincter muscle. Okay, here it is one diagram which shows the trigeminal ganglia, and from which there is sensory supply. The sensory supply goes to this, or sensory supply to this ciliary ganglion, and from this the sensory supply goes to the eyeball. The sensory supply goes to the eyeball through the two different route. It may goes to the long ciliary nerve, or it may goes to the short ciliary nerve, and these are the sensory. The sensory rootlet is a sensory rootlet, sorry, the sympathetic node, sorry, the sensory root. The sensory root come from the nasociliary nerve, and the sympathetic root come from this carotid plexus. So the sympathetic root come from the carotid plexus, it goes to this ciliary ganglion, and then goes to the eye, and from this region the sensory root, it come to the ciliary ganglion, and from this oculomotor nerve, from this region the parasympathetic supply goes to the ciliary ganglion, and this thicker one, this is the optic nerve, and from the nasociliary nerve, the branches which goes to the eyeball, this is the long ciliary nerve. So this is the Edinger-Westphal nucleus, and this is the oculomotor nucleus, lies closely. From this Edinger-Westphal nucleus, this is the oculomotor nerve which goes to the ciliary ganglion, and it short ciliary nerve, it supplies this parasympathetic it is the parasympathetic innervation, and from the superior cervical ganglion, this is the sympathetic innervation, and the third one, from this trigeminal nerve, the innervation goes to this ciliary ganglion, it is the sensory innervation. Okay, and the nucleus of this parasympathetic innervation come from this Edinger-Westphal nucleus. So this sensory root comes from this trigeminal nerve, this is the nasociliary nerve. From this region the sensory root goes, sensory innervation goes to the ciliary ganglion, and then it goes to the eyeball, and this is the parasympathetic, it is through the short ciliary nerve, it goes to the eyeball, and the sympathetic root, it goes through this short ciliary nerve to the eyeball. In this region there may be some connection. The long ciliary and short ciliary, it both the long ciliary and the short ciliary, it both contains the sympathetic fiber and the sensory fiber, and this short ciliary, it only, and the parasympathetic fiber, it goes only through the short ciliary nerve, but the short ciliary nerve, in general, the short ciliary nerve, it contains three types of fiber, and the long ciliary nerve, it contains the sensory and the sympathetic fiber. It is a schematic diagram. This is the ophthalmic nerve, this is the carotid plexus, and this is oculomotor nerve. This is the parasympathetic. So the motor route, it goes to the, from this parasympathetic inferior division of the oculomotor nerve, the motor route goes to the ciliary ganglion, and then from through the short ciliary nerve, it goes to the eyeball. Now from the carotid plexus, the sympathetic route, it enters this area, it do not synapse in this region, it directly goes towards this eyeball. Okay, is the sensory route, it goes the sensory, this part is the sensory ophthalmic nerve, the sensory route enters in this region but do not synapse, and again it goes to this eyeball. So this short ciliary nerve, it contains this sympathetic, sensory and the parasympathetic fiber, and the long ciliary nerve, it contains the sympathetic and the sensory fiber. This long ciliary nerve, it do not contains this parasympathetic fiber. Okay. The branches of the ciliary ganglion. The branches of the ciliary ganglion are the short ciliary nerve. These are delicate filament, 6 to 10 in number, which arise from the anterior part of the ganglion, two bundles connected with the superior and the inferior angle. It carries the sympathetic, parasympathetic and sensory fiber for the eyeball. These are the short ciliary nerve. These are the branches of the ciliary ganglion. Okay. Then come to the tracing of this parasympathetic nerve. It is one of the important part. The tracing of the parasympathetic nerve, from which this parasympathetic nerve or parasympathetic roots appear and up to which it goes and ends. The preganglionic parasympathetic fiber start from the Edinger Westphal nucleus. Then it run along the oculomotor nerve, then along the inferior division of the oculomotor nerve, and along the branch to the inferior oblique to the ciliary ganglion, and relay here, and from the synapse, it forms a synapse, and the postganglionic parasympathetic fiber, it start from this ciliary ganglion along the short ciliary nerve to reach the sphincter pupillae and the ciliaris muscle. So this is the tracing of this parasympathetic nerve. Tracing of the sympathetic route. Fibers start as the postganglionic sympathetic fiber from the superior cervical ganglion, from plexus around the internal carotid artery to the ciliary ganglion, but there is no synapse. Run along the short ciliary nerve or the long ciliary nerve, supply blood vessel to the eyeball and the pupillary dilator muscle. Then come to the sensory route. The sensory fiber from the cornea, iris, choroid, etc., it via short or long ciliary nerve, it is the ciliary ganglion, and from the ciliary ganglion, the sensory impulses goes to the nasociliary nerve, then to the ophthalmic nerve, and then trigeminal ganglion, and from the trigeminal ganglion, the impulses goes to the sensory root of the trigeminal nerve, and from this region, the principal sensory nucleus and the spinal nucleus of the trigeminal nerve. This is the tracing of the sensory route. Then come to the blood supply and lymphatics. It receives vascular supply from branches of the posterior ciliary artery, central retinal artery, and the muscular branches which supply the extraocular muscles. Then come to the applied anatomy part. You know this eddy tonic pupil. Eddy's tonic pupil is characterized by an idiopathic, sudden onset denervation of the ciliary body and iris sphincter, followed by a slow abnormal re-innervation. This results in a sudden, fixed dilated pupil and loss of accommodation in that eye. If you come to this image, you can easily understand the picture. If the person looks open eyes in the dark, then this is the size of this pupil. In room light, there is some contraction of this pupillary aperture. And bright light, there is constriction. This is the normal phenomena. In dark light, the wide pupil. Room light, normal, and in bright light there is a constriction of the pupil. But in Eddy's pupil, This dilation, this dilated pupil, it is constant. It does not react with this light. And in case of near vision, you all know the eyeball, the cornea or the eyeball, it projects medially, and there is a constriction of this pupil. Again, there is less constriction of this pupil. It is known as the eddy-tonic pupil. Eddy-tonic pupil is typically initially unilateral with increased risk of involvement of the contralateral pupil over time. The denervation occurs at the level of the ciliary ganglion, with aberrant regeneration of accommodation occurring over the course of the next 1 to 2 years. The injury or the tumor or the herpes zoster infection or any other infection of this region may lead to this eddy-tonic pupil, which affect this ciliary ganglion. So in this part, this is the normal phenomena, but this type of pupillary reflex is known as the eddy-tonic pupil. And this is the visual pathway. The visual pathway, there is one important thing. This is the ciliary ganglion. It completes the pathway. This visual pathway, the sensory part, the efferent come to this optic nerve, then it goes to the pretectal area. From this pretectal area, there is interneuron, and interneuron goes to the adrenal western nucleus, and from this adrenal western nucleus, the parasympathetic impulse goes towards the eyeball, and it forms the ciliary ganglion, and from the ciliary ganglion, the postganglionic fiber reaches to the pupillary sphincter muscle. And this pathway needs one intact ciliary ganglion, one normal ciliary ganglion to react normally. So the visual pathway, it is very much important for this light reflex or the accommodation reflex, and the ciliary ganglion is one of the important part of this visual pathway. So this is all for the ciliary ganglion, and thank you for your presence in these online classes. Thank you.